vaccine communication is not an easy thing. Having a conversation with someone who may be vaccine hesitant, whether that be a parent or an adult at any age, we need to spend time with them discussing, what is their issue and actually, trying to break down where they're coming from. And that's not an easy conversation for someone. It takes time, it takes practice. But we know for our immunisation providers, they may not necessarily have had that communication training while they were at university. It may not have been part of the curriculum. So a lot of that and their skills probably have come from on the job. Maybe things they've picked up from conferences or from small workshops, but really, they haven't had a lot of intensive training around how to do that one-on-one communication with someone. So what we know now, and there's been lots of great studies that have shown it, that we actually need to have some tools to support providers to have, those communication episodes. And so they've been putting together a range of different strategies to support that. And that may be the motivational interviewing space, or it could be other strategies about helping people, how to approach the conversations. And these are all great tools that have been tested in research settings, published studies have been put out about them, they have been evaluated. What we then went and did is actually tried to find those tools. So we kind of put on the skin of maybe an immunisation provider, whether that be someone in the primary care setting or someone who's hospital-based, maybe a school-based provider. And we actually then just went and tried to search for these strategies, tried to see whether we could find a tool that could help us in improving how we communicate. The problem is we couldn't find them. So we know that they are out there, but at the moment, there's not a lot of signposting to actually get to these tools. And we looked in a lot of different ways. We used catalogues to try and trace them. We went to health department websites. We really tried to, change up the way we did our search strategy. And we couldn't find these particular tools, which is a really big issue because what we know about providers is that they are time poor. They have limited time during their day. They're dedicating that time to their one-on-one consultations. They may not have time to dedicate it to this sort of training. So we need to make it easier for them. I do a lot of work around hospital-based immunisation, and in that setting, it's even worse. They don't get as much information pushed through to them as people in a community setting. So they probably don't even know maybe that these tools are in existence. No one has spoken to them about them. So what can we do about that? In our journal paper that was published in Vaccine, we suggested that maybe as one strategy, we could be putting together a central depository where we could put all of maybe these interventions or maybe links to these interventions. And we could also maybe put some guidance around how to select the best strategy that kind of works for you as an individual.